Have you ever opened your eyes in the morning, looked around your bedroom, and felt as though someone had quietly placed a thin fog over the world while you were asleep? For a few unsettling moments, the familiar shapes of your home seem soft, distant, or strangely out of focus. Then, almost as mysteriously as it appeared, the blur slowly fades away, and you continue your day believing it was nothing more than part of waking up. But what if those few blurry moments are not an innocent morning inconvenience? What if they are the earliest whisper from your eyes, trying to warn you about a problem long before pain, permanent vision loss, or serious disease ever arrives? Millions of adults over the age of 40 experience blurry vision in the morning and simply dismiss it because it disappears so quickly. Yet the human body has an extraordinary way of sending quiet signals before it raises a loud alarm. Your eyes are no different. They rarely begin with dramatic symptoms. Instead, they often reveal subtle changes that appear for only a few minutes, hoping you will notice before the damage becomes difficult to reverse. The greatest tragedies in eye health are not always caused by conditions that arrive suddenly, but by warning signs that are repeatedly ignored because they seem too small to matter. Imagine discovering that a habit you have accepted for months was actually your body's earliest request for attention. Imagine learning that those brief moments of blurred morning vision could reveal dry eyes, temporary changes in the tear film, fluctuations in blood sugar, sleep-related eye exposure, or even the beginning of conditions that deserve professional evaluation before they silently progress. The remarkable truth is that your eyes never stop communicating even while you sleep. During the night, tears redistribute across the surface of the eye. The pressure inside your eyes naturally changes, and every tiny structure responsible for clear vision undergoes delicate adjustments before you open your eyelids to greet another day. When any part of this incredible system struggles to return to perfect balance, the first clue may appear only in those precious first minutes after waking. This is why understanding blurry morning vision is not about creating unnecessary fear. It is about recognizing the wisdom hidden within your own body and responding before temporary discomfort becomes lasting regret. By the end of this journey, you will understand why morning blur happens, which causes are usually harmless, which warning signs should never be ignored, and when it is time to seek professional eye care. Most importantly, you will discover that protecting your eyesight is not only about reacting after something goes wrong, but about recognizing the earliest signals before they become life-changing problems. Stay with us until the end, because one commonly overlooked symptom experienced by countless people every morning may completely change the way you think about your vision, and the most surprising explanation is still waiting to be revealed. As you continue listening, the mystery becomes even more fascinating because not every case of blurry vision in the morning has the same explanation. In fact, the same symptom can arise from causes that range from completely manageable to conditions that require timely medical attention. One of the most common reasons is dry eye disease. While you sleep, your eyes produce fewer tears, and if your tear film is already unstable, the surface of the eye may become dry and uneven. Since light must pass through a perfectly smooth surface to create a clear image, even a small disruption can make everything appear blurry until blinking restores moisture. Many adults over 40 experience this without realizing it, especially those who sleep under a ceiling fan, use air conditioning throughout the night, spend long hours looking at digital screens during the day, or take certain medications that reduce tear production. Yeah. Another possible explanation is that your eyelids may not close completely while you sleep, exposing part of the eye to the air for hours. This condition can quietly irritate the cornea and create temporary blur that gradually improves after waking. Blood sugar changes can also influence morning vision. When glucose levels fluctuate, fluid shifts within the eye can temporarily alter the shape of the natural lens, affecting how light focuses. For some individuals, blurry morning vision may even be one of the earliest clues that their blood sugar deserves professional evaluation. There are also cases where sleeping positions contribute to temporary changes in eye pressure, especially in people who sleep face down or press one side of the face firmly into a pillow. Although these changes often resolve quickly, they remind us that our bodies continue to respond to gravity, circulation, and pressure even while we rest. But here is where the story takes a more serious turn. Sometimes persistent morning blur may signal conditions involving the cornea, the optic nerve, or the retina. Early glaucoma, corneal swelling, Fuchs's endothelial dystrophy, cataracts, or age-related macular changes may initially produce subtle symptoms that appear only under specific circumstances, making them easy to dismiss. This is why paying attention to patterns is far more important than focusing on a single episode. If blurry vision lasts longer than expected, becomes more frequent, affects only one eye repeatedly, is accompanied by pain, flashes of light, new floaters, severe redness, or a sudden loss of vision, these are signs that should never be ignored and deserve prompt professional eye care. The greatest danger is not always the condition itself, but the delay in recognizing it. Many people wait until the blur becomes constant before seeking help, only to discover that valuable time has already been lost. Yet the remarkable thing about many eye conditions is that when identified early, they can often be monitored, managed, or treated far more effectively than when symptoms are ignored. And still, one powerful piece of this puzzle remains unexplored, a simple daily habit that countless people overlook, even though it may quietly influence the health of their vision every single morning. Every sunrise offers more than the beginning of another day. It offers another opportunity to notice the quiet messages your body has been sending all along. Your eyesight is one of your most precious gifts, yet it is often appreciated only after it begins to change. The simple act of waking up with blurry vision may seem insignificant, but sometimes life's greatest lessons arrive in the smallest moments. Rather than fearing every symptom, choose to become curious about it. Observe whether the blur disappears after a few blinks, whether it affects one eye or both, whether it occurs every morning or only occasionally, and whether it is accompanied by discomfort, light sensitivity, headaches, flashes, floaters, or persistent vision changes. Keeping track of these patterns can provide valuable information for your eye care professional and may help identify problems before they become more serious. Supporting healthy vision also means supporting your entire body, staying well hydrated, maintaining balanced blood sugar levels, eating a diet rich in colorful vegetables and omega-3 fatty acids, protecting your eyes from excessive ultraviolet light, taking regular breaks from digital screens, getting adequate sleep, and scheduling routine comprehensive eye examinations all contribute to preserving your sight as you age. These daily choices may appear ordinary, yet their long-term impact can be extraordinary. Remember that your eyes are not isolated from the rest of your health. They reflect the condition of your blood vessels, your nervous system, your metabolism, and even your lifestyle habits. That is why blurry vision should never be ignored. If it becomes persistent, worsens over time, or appears alongside other concerning symptoms, seeking professional eye care is not a sign of fear. It is a commitment to protecting one of your most valuable senses. Early evaluation can often reveal conditions while they are still in their most manageable stages, allowing treatment or monitoring before lasting damage occurs. The true wisdom lies not in assuming the worst, but in refusing to ignore what your body is trying to communicate. Every clear morning begins with healthy eyes, and every healthy future begins with informed decisions made today. Let this video serve as a reminder that awareness is one of the most powerful forms of prevention. The more you understand the subtle language of your vision, the better prepared you become to protect it for the years ahead. A few moments of attention today could preserve countless beautiful moments tomorrow, allowing you to continue seeing the faces you love, the places that inspire you, and the experiences that make life meaningful. Never underestimate the value of early action, because protecting your eyesight is not simply about seeing clearly today. It is about safeguarding your independence, your confidence, and your quality of life for the future.